Unfortunately, intimate partner violence persists as a very prevalent problem, affecting 1 in 3 or 1 in 4 if you are just focusing on severe physical, but 1 in 3 if you're including emotional, psychological, sexual, physical, stalking, all different types of abusive behaviors. So 1 in 3 women experience intimate partner violence sometime in their lifetime. And so it's extremely prevalent. And the sequelae for this, both while they're experiencing that unhealthy relationship as well as even afterwards, can really be, can have some long-lasting mental health impacts. PTSD, depression, generalized anxiety disorders, substance use disorders, all sorts of things. And so definitely, I'm really glad that we're including intimate partner violence as part of this day. So the impact of the pandemic on anything related to emotional and mental well-being has been dramatic, certainly. With regard to actual numbers related to the increase, it's very difficult for us to see, partly because some of these issues, especially an issue like intimate partner violence, is fairly hidden. What we hear are different reports, and certainly we've heard probably some media stories, certainly some stories from other countries with regard to increased violence because of the lockdown measures, because of the increased stress that might be related to the pandemic. What we've seen too in terms of the impact in the United States has been this paradoxical decrease in hotline calls and in accesses or requests for shelter. But that actually, if you talk to the intimate partner violence victims advocates, has been a concerning type of a trend or a concerning finding, because what they're afraid of and what we perceive is that people are not able to get the help that they need. They are now more closely monitored when they're isolating at home by their abusers. They have less avenues for accessing resources or supports than they did before. There had been maybe some misunderstandings that maybe some of the shelters were also closed and not allowing people to access their services, although many of the shelters really did try to remain open and worked on different measures to try to help keep everyone safe in those locations, either by contracting with hotels to get people private rooms or finding other types of spaces so that people can socially distance and keep themselves safe. So definitely, I think the pandemic has impacted intimate partner violence in a variety of ways. We have heard from advocates who've talked to their clients and had the challenges of folks not having access to the technology that allows them to be contacted, or that even the issue with regard to the decreased finances or the instability with regard to housing and evictions, that has all raised the prospect of feeling more tied to and dependent upon their abusers. There's been also some situations in which abusers have used the pandemic to exert control. You know, basically saying, you're not allowed to go out. We don't want to be exposed from COVID. You have to be sort of here under my control. And then some reports with regard to the stimulus checks being commandeered or taken by the abusers. So it's been, there's multiple different impacts that the pandemic have had. So other issues that the pandemic has caused for the women and children living in abusive situations has, I think that, again, the key component has been the limitation of access to resources. You know, not being able to go out, having things closed, having lockdown sort of measures has made it frightening in the sense that there's limited places for them to reach out to for getting help. Even in terms of the medical environment, a lot of times we view the healthcare centers and the healthcare visits as opportunities to provide resources and to reach out to and increase awareness of domestic violence or intimate partner violence to our patients. And with the conversion to telemedicine, one of the challenges there has been the worry about who else may be in the room. You can see my screen here, but you don't know who's behind the camera or behind the computer. And so that makes having really open and frank conversations about intimate partner violence and safety more challenging when you're not quite certain who else may be listening. And so that sort of component of how we even bring up the topic and get resources out to those who may need it has been challenging. It's been required us to try to brainstorm ways of making information pushes, of actually getting these awareness messages and the resources out to people, rather than having that sort of older framework of screening and then providing the resources. Right now, I think we really just need to be giving the resources more broadly. So definitely there's been some research that has indicated that there's been some increase in substance use during the pandemic. Certainly there's been increased purchasing and presumably use of alcohol. Certainly I think that we're seeing that the opioid epidemic, which had started to kind of trend in a little bit of an improved sort of direction, and I know that Liz is going to talk a little bit more about that, but that seems to be worsening again. And so certainly when individuals are facing a very stressful situation, then there are going to be the temptations to self-medicate or to escape and to cope using substances. One of the challenges with that is that we also see that substance use is associated with increased severity and danger in physically and sexually abusive relationships. And so that can raise the risk level for individuals who might be in intimate partner violence situations. So in terms of my own past research in intimate partner violence, in the field of intimate partner violence, it had really focused on how healthcare providers can best help women who are experiencing intimate partner violence. And that work to me had been really interesting in the sense that it really focused on how women want to receive the information. In the past, the model had been more the whole, let's ask, and once we ask and diagnose it, then only when we diagnose it can we actually offer the resources and support. And what I had learned from my past research had been that women may have a hard time disclosing, and to rely on that disclosure could actually be missing a lot of opportunities for us to reach out and provide that help, because what they did say is that they would like the information even if they don't disclose. If there are resources, if there are hotline numbers, if there's even just brochures that really talk about what constitutes intimate partner violence and what kind of strategies that people have that help protect themselves, that they would find those useful even without disclosure. And so that had been a key element of the research that I'd been doing that I'm now working to try to disseminate. It's become very relevant now too, I think, because of the pandemic, and because especially as we're relying a little bit more on telemedicine or telephone sort of medicine, this issue with regard to feeling confident about who else is in the room or who may be actually in the visit, who we may not know maybe listening in on the visit is challenging. And so that has to have us rethink and reframe how we approach this issue and this topic. And how can we do it in a way that actually makes it a little bit more generalized, and it doesn't sort of label a person as being, you're one I'm suspecting is going through this, but more, I'd like to provide you with some information that many people have been finding helpful for either themselves or people they might know. The pandemic is certainly making things really tough for folks with regard to a lot of mental health issues, depression, anxiety, substance use, and then also, violence or tension or harm within their relationships. So we wanted to make sure that everyone had these resources available so that they could use it or they could pass it on to others who might need it. And so if we make it really global and universal, then it doesn't, or hopefully it doesn't, increase their own individual risk. So that's one of the elements of my research, and that's one of the things that we've been working on. Right now, another topic that we are working on, I've had the privilege of working with several other investigators here at Pittsburgh, Dr. Liz Miller, as well as Dr. Maya Raghavan, as well as another investigator in Kansas City, Dr. Kim Rendell, and then a whole group of advocates and policy people with the CDC and the American Academy of Pediatrics, and with the advocacy organization Futures Without Violence. And so we have actually been working on a nationwide survey of this issue of domestic violence as well as child abuse and how to respond to it and how people are impacted by these things during the pandemic. And so that's an ongoing study that we've been working on as well. Yeah, no, absolutely. I think that would be the thing that would be important for all people who might be experiencing, or even might just be wondering if they're experiencing intimate partner violence, to know is that the resources are still out there. They're still open. They're still working. The advocates, there may be this misunderstanding that a lot of these businesses or a lot of these organizations are sort of closed, but they're not. They're all still working 24/7 on behalf of individuals who are experiencing violence. And so definitely the resources are still there. The National Domestic Violence Hotline number is 1-800-799, and it's SAFE, S-A-F-E. But if you want the numbers, that's 1-800-799-7233. And so that would be a key resource that allows you to actually access this, and they've got the Rolodex of everybody else, and even in your own region. So they can provide emergency crisis counseling, safety planning, as well as link the caller to their local resources as well. But in terms of for us, for Allegheny County, our local resources would be the Women's Center and Shelter of Greater Pittsburgh, whose hotline number is 412-687-8005. And then the Center for Victims, who also have a domestic violence shelter and resource center as well. And their number is 1-866-644-2882. So definitely these are resources that that I'd like to make sure that people know are still available and are definitely all working to strategize how to provide their resources, services, counseling, and shelter to anyone who may need it in a safe manner, accounting for the safety measures that we need to all be practicing during this pandemic. The signs and signals that individuals might be on the lookout for to pick up on the possibility of intimate partner violence are varied. I think that a key sign would be reduced contact, more isolation. If a person seems not able to be reachable or not answering calls, that starts to, and especially if they had in the past, that starts to make you a little concerned about their well-being. And so what I would recommend is doing more checking in. And I think that has been one of the things that has helped with resilience overall during this pandemic, is when people check in on each other, when they, when they're reaching out to see what their neighbors or loved ones, their friends, their colleagues may need, and to check in and see how they're doing. But honestly, we've got this new technology in terms of things like Zoom and the Microsoft Teams and the other sort of video calls, and that's another way of sort of trying to see if you can peek in and just get a sense on how they look and how they're doing. Do they look like they've changed weight? Do they have any sort of signs that things are a little bit more in a disarray? But I think the main thing that would get me concerned is some increased isolation. When you stop hearing from folks, or when they're not responding as much as before. And that would usually get me a little bit more nervous and more worried. So if I were talking to someone who had shared with me that they're experiencing intimate partner violence, the key first things that I would want them to know is, one, that they did not deserve that. They do not deserve to feel threatened, afraid, demeaned, humiliated, controlled by anyone. There's nothing that they did to deserve that. Nobody deserves to be hurt and afraid by the people who are supposed to love them. So that would be a key thing that I would definitely say. The other key thing that I would say is that they're not alone, that help and support is available, and that those who know about this issue are available to provide whatever ideas, support, resources, suggestions, protections that they can offer. So those would be the two key things that I would share.